thankful for everybody who participated in that. And I have some good news. Those of you who didn't catch the deadline, which was last week, we're extending the program. So again, if there's anybody who would like to make a donation to the homeless, we're doing this through the Office of Poor Relief and the Kingston office. We're offering close to the Mayor Atkins shelter, as well as the Desmond McKenzie home. And we're asking for specific items. We're asking for men's clothing, particularly size medium and size small. We're for shoes, canned goods are also like to make a cash donation. So if you go to our Instagram page, you will see the details. We're also circulating the information. So we ask for everybody's support. We want to try and make a material difference to the homeless. And through this donation, you can call myself. My number is there, as well as DLG Willie. And we accepting donations between now and Friday. And we'll make a further presentation to the Office of Poor Relief under that program, Hope for the Homeless. So those of you who have already donated, thank you very much. And those who would like to continue and extend a further donation, please reach out to any Kingston Club member or DLG Willie or myself, and we'll be able to accommodate it. We'll pick up the items if you need, and we'll make the donation on your behalf. So those are my remarks. I'm glad that we have so many persons attending this evening. I hope the presentation this evening is called Below the Belt. And it's about men's health, and you'll hear more as DP Stu explains, but it's something that is relevant to everybody. We're all the men in the Kiwanis movement, as well as their partners, and everybody. It's something that is a health-related issue that is very topical and relevant to us. So thank you again for your attendance, and I'm going to ask now DP Junior Stewart, who is to join us and do the welcome and to the visiting clubs, members, and guests. Over to you now, Junior. Sorry about that.
My time.
Yes, your time.
My time now. Okay.
Yep. Okay.
Let me welcome you all to this meeting. I noticed there are quite a few people that are on. Let me welcome all our visiting members who are on with us and our own members. Tonight, as you have heard, we'll be having a very interesting topic. It's Below the Belt with our own Kiwanian Andy Baptiste. I know it's a man's topic, but I know there are a lot of ladies that are on who will be listening very keenly to assist their men, their husbands, their sons, friends, male friends, and I know that they'll be listening very keenly as well. I'm going to be starting with giving you the opportunity to introduce your members from your respective clubs. And we start with Division 25, the overseas members, Kiwanians, would like to very briefly introduce their members who are on with us tonight. We start with Division 25. Those members that are on?
Yes, not many, but good evening. I'm not sure, is it IPP or DP? I thought someone said DP. DP Junior.
IPP, DP by now, I think.
Okay. Speak it.
But IPP is still relevant.
Okay. Right. So good evening, IPP Junior. Fellow Kiwanians, I see a lot of my friends on there this evening. Interesting topic. This is past District Trustee Vivian from the Kiwanis Club of Montego Bay. I am deputizing for Director Crystal, who is the chairman for Interclub. I think she's on, but I'm not sure she can open her microphone at this time. I have not seen anyone else on as yet, but I'm pretty sure that others will be joining. The rain seems to be all over the island, because I was in Montego Bay today and it rained, and I'm in St. Elizabeth now and it was raining as well. So looking forward to an interesting evening, and I hope every one of us enjoy the topic this evening. Thank you once more, and greetings from the West, because I'm not seeing anyone else there.
Yes.
Thank you.
And thank you to be with us this time. It's very wet evening. And
Good
I'm
night,
hoping, and I know that a lot of your members, some of your members, will be joining with us later on. Thank you again.
Yes, you're welcome.
Good. Any other members? Division
Yes.
25?
Good night, everyone. This
Yes.
is President Tonian from the Kiwanis Club of Coastal Trelawney, and we have
Good.
members on our platform tonight. We look forward to an interesting meeting because it's a very intriguing topic.
Yes. Thank you for coming. We certainly enjoy you being with us tonight, and we guarantee you that the meeting will be very interesting. Thank you again for coming.
Good evening,
Any
everyone.
other? Yes.
This is Chairman of Interclubbing, Delana Delissa of Kiwani of Coastal Trelawney. Thank you for having us. As our president I just expressed gratitude. I am actually looking forward to tonight's meeting because I had a conversation with a doctor about 2 weeks ago pertaining to the topic that I am anticipating will be presented on tonight. So I am very intrigued as to what pointers will be brought to the forefront. Thank you.
All right. Thank you for coming, President, and we all look forward to a very interesting topic tonight. Thank you again for coming. Any other member? What about Division 24? Division 24. Members from Division 24 that would like to introduce their club at this time, let us do so quickly. Division 24. Division 24. Not here. Some of you are not here yet. Still get caught in the rain. Let us go to Division 23, and we'll go to Division 23 East. Division 23 East, those members from Division 24 East. What about Division 24? Oh, go on. Yes. 24 East.
24
Very
East,
good
okay.
evening to you. We are hearing.
23 or 24.
Did you say 23 or 24?
Oh, sorry. I'm sorry. Thank you, PDT Rassan. We are now at 23, and we are at 23 East. Sorry.
Okay, good evening. Good
Is there
evening,
anybody from 24 though?
distinguished
That I skipped. 23 East. If we have any member from 24, you can always come in as soon as
Okay,
you get
good
it.
evening. Good evening, distinguished Kiwanians. I am Chair Latavia of 23 East Professional
Good.
Trade and Online. And currently we are 3 in numbers. We're expecting more. I'm looking forward to an interesting meeting.
Yeah.
And thank you for the invite.
Okay. Thank you for coming. And we hope that more of your members will be here in due course. 23 East.
Good evening.
Good evening to you.
My name is VP Brian Fletcher from EKPR. Thank you for having us. We are 6 or 7 of us are here tonight, including the president. And we want to say thank you for the invite.
Thank you for coming, and I know that you are in full force tonight.
Yes, sir.
Thank you again for coming, DP. Thanks. Yes, 23 East.
Thank
Okay,
you,
V
DP.
Junior.
Yes.
Go ahead, Eileen.
Oh.
I was going to yield to you, DLG.
Please go ahead.
Okay.
Thank you, DLG, Gertrude. IPP Junior, President Stephen.
Yes.
I just want to say congratulations again. DLG Eileen, Kiwanis Club of Worthington, Kingston. Visiting with you at this meeting of interests are 1, 2, 3, 4, 5 members, including our IPP Kamiko. Our President Sherry Gay will be joining, and greetings on behalf of the Kiwanis Club of Worthington. Looking forward to an interesting and informative health presentation.
And thank you again for coming, DLG. We certainly welcome you, and we glad that you are here with us tonight.
You're welcome. All the best,
And
President.
Okay, baby Junior.
Yes.
With 23 East, I bring you greetings from the Kiwanis Club of New Kingston.
Yes.
Very interesting topic. I hope the men will really listen. I'm sure the women will support. But there are 7 of us online with you. And we're giving you a very informative and really, really interesting meeting seem to be coming up. Have a great evening, everyone. This is DLG Girthlin.
Yes, thank you, DLG Girthlin. And you do enjoy the meeting as we go along.
I will
and
try.
As usual, your club is here with a very strong contingent. Thank you for coming again. And I'm sure that more of you will join as the meeting progresses.
I am sure they will. Thank you.
Yes.
Good evening.
All right.
This is
Good evening.
This is Director Terry Ann from the Kiwanis Club of Pavine. I'm the only one on right now. I have other persons that are expected to join. As usual, thank you so much for your invitation, and we look forward to a wonderful meeting.
Yes, and thank you for coming. Division 23 East. Any more from Division 23 East? Let us go to Division 23 West.
Good evening, IPP Junior. This is
Hi,
President
how are
Henry.
you doing?
Not too bad. This is President Henry from the Kiwanis Club of Portmore, St. Catherine.
Beautiful.
We are 3 in numbers, and as an all-male club, it's a really interesting topic. I know other members will be joining shortly, and we'll be listening keenly. Thanks for the invitation.
And thank you for coming. It's raining in the Sunshine City as well, in Portmore.
It is as hot as fire. No rain.
No rain. Sunshine City. Yes. Okay. Any others from Division 23 West?
Good evening, IPP Junior.
Yes.
Bring you greetings from the Kiwanis Club of Mandeville. We are 2 in numbers. Early on before your meeting started, there were 4, but I get to understand there are power outage in some areas of Mandeville, so 2 of our members are off. But there are 2 of us on, President Kashev, and I am DP Josephine. Looking forward to an interesting meeting.
Yes, glad to have you, DP Josephine.
Yes, Daddy.
Is it raining in Mandeville as well?
Yes, we are having rains.
It's raining.
I think that is what caused the power outage in some areas.
Right. Thank you for coming. We hope the other members will join in due course.
I hope they get to come back on, but the president is on, and myself.
Okay. Thank you. Thank you again.
You're welcome.
Good. Division 23 West.
Good evening, IPP Junior.
Yes.
I am President Ornette, and I bring you greetings from the Kiwanis Club of Sunshine City, Portmore. We are looking forward to a very informative meeting, and we thank you for the invitation. At the moment, there are 2 of us online.
Still 2 so far.
Yes.
Okay. Thank you for coming.
You're welcome.
Good. Any other from 23 West?
Yes, IPP Junior.
Yes.
IPP Derek from the Kiwanis Club of Spanish Town.
Okay.
Very happy to be a part of your meeting this evening. And as an all-male club, I'm sure that I'm alone at the moment, but I'm sure that a few of my members will join later.
Yes. Thank you. Thank you for coming. Any others from Division 23 West? Division 23 West. If not, we move to our own division, Division 23 Central.
Good evening, DP Junior. This is
Good
President
evening.
Claudine from the Kiwanis Club of West St. Andrew. It is always a pleasure joining the Kiwanis Club of Kingston's meetings. Thank you for the invite. There are 4 of our members joining the meeting this evening. And yes, the topic is male-centric, but we look forward to hearing how we can support the men in our lives and our families. So thank you.
Good. Good, and thank you for coming as well.
You're welcome.
Division 23
Good
Central.
evening, P. Junior. How are you doing?
I am doing fine. A
I
little
am.
raining now, but we are
Oh,
okay.
okay. It sounds like you need some rain down there. Last time I was there, it was so hot. Oh my goodness. Jeez.
Okay.
Yes, and even when
Okay,
it
we're
rained,
getting
it
some
never
rain.
changed. Even when it rained, it never changed. It was like the heat came right after.
Good.
Anyway.
Global warming, they call it.
Oh no, they say it's not real.
Yes.
Anyways, that said, I am President Eurydice from the Kiwanis Club of 23 Central Story Online. And at this time, I am here with my friend, Peter Gay, President Peter Gay from Stony Hill, who also is a dual member. So we both are here and holding down the fort for 23 Central Story Online. Okay? So thank you, and I look forward to this meeting. Yes.
Yes. We welcome you as we usually welcome you. You're usually at our meeting.
Yes,
You're
I'm a
one of
part of the club by now, right?
Yeah, you're one of the female members of our club.
Yes, I believe that too. All right.
Yes.
Okay, have a good one.
IPP, good evening. This is DP Paulette, Kiwanis Club of Friends Across Borders.
Okay.
The invite, and we are looking forward to the interesting conversation that this meeting is going to bring, and how we can also, as the females, mothers, sisters, support
wives,
the parts.
Okay.
Yes, of course.
We
We are
certainly welcome you.
but I'm expecting others to join.
Okay. And thank you for coming. We welcome you at our meeting.
Good evening, IPP Junior. This is
Yes.
President Sharon from the Kiwanis Club of Constant Spring. With me this evening, we have DP Pat, Governor Pamela Rodney White, and we'll be joined later by other members. Thank you for the invitation.
And thank you all for coming. Governor Pat, Governor, you're on there tool. I didn't see you earlier. No, Governor Pamela.
That's okay, IPP Junior. I see you're very relaxed, so that's fine.
I
No
am.
problem. I was
Thank you for being with us.
Yes, I was marshaled to attend this meeting because I have night husband and day husbands. I need to come and get all the information that I can take back for them. Have a good one.
All right. Thank you.
Good evening.
Any other?
In IPP Junior.
Yes, I'm hearing you.
This is President Peter Gay from the Kiwanis Club of Stony Hill. Kiwanis Club of Stony Hill. This is President Peter Gay. And I want to thank you for your invite to this very interesting topic and also very important. So we are 3 in number and we're looking forward to a very engaging presentation. Thank you for the invite.
And thank you for coming. It looks like we have more ladies than men, but that is okay.
Good afternoon, IPP Junior. This is President Tony Tomlinson from the Kiwanis Club of Barbican. Thank you for the invite to the meeting. Looking forward to the very interesting topic. As social as a man myself, I need to know, what I need to learn about health. Currently, we have 5 in numbers and more to come.
Good. Thank you for coming. And thank you for being with us tonight.
Good evening.
Good evening. This is
Yes.
VP Omar from the Kiwanis Club of North St. Andrew.
Yes.
I have
Okay.
Thank you for inviting us to this meeting. As a man, I'm looking forward to the meeting, actually, the discussions. And
Right.
we have 7 online with us
Oh.
tonight.
Yeah.
Thank you.
Everybody seemed to be out with a big contingent tonight. Thank you all for coming. Division 23 Central, anymore? Any other Kiwanians that would like to bring greetings to us at this point in time, you could do so.
IPP Junior, and I just went to Kiwanis Club of Spanish Town, the LGE Anthony is also on.
IDLGE. Yes, go ahead, we're hearing you.
No, I'm saying DLGE Anthony is also online from the Kiwanis Club of Spanish Town.
Good.
I am sorry, but we have played DLG Anthony already from North St. Andrew.
Yes, I think I heard that. I was just
Okay,
about.
okay.
But anyhow, that's okay. That's okay. That's not a problem. DLGE, thank you for coming. Thank you for being with us. Any other Kiwanian that would like to bring greetings? Any other Kiwanian online that would like to bring greeting on this time?
IPP Stewart Jr.
Junior,
This is
yeah.
this is IPP Roy from the Kiwanis Club of Toronto Caribbean.
Okay.
I am alone for the moment, and
Yes.
I say congratulations to President Stephen.
Stephen.
Yes,
Yes.
and I'm looking forward to enjoy the meeting. Hi, Ralston.
Yeah, Raleigh's on as well. Thank you for coming. You have always been with us. We hope and we know that you are going to enjoy this meeting tonight. Anybody else that would like to bring greetings at this time? I think we are a little
Yes, good
extended
evening.
tonight. Yes.
This is President Ashana from the Kiwanis Club of Charlton, Alexandria. I have 3 persons
Okay.
online with me. I sent it in the chat, but I like open my mouth and chat, you know? So thank you
I
so much
see.
for having us. I don't come from foreign, but we in the far cool hills in Charlton, Alexandria. So we're bringing you cool greetings from there. I'm so excited to be on the meeting. We don't see topics like this very frequently, so I'm really excited
Right.
for it. Wishing you
All
all the
right.
best with this meeting. Thanks for having us.
And thank you very much for coming. Anybody else? Anybody else would like to bring greetings? Okay. We take it's going to be a very interesting meeting tonight. So I don't want to hold up any more of Kiwani and Andy time. So I am going to back over to you now, President Stephen.
Thank you very much, DP.
Yes.
I was going to ask if you wanted to segue into birthdays and anniversaries, since you're already on the floor.
Yes. Okay.
If anybody's having a special occasion today.
Who is having a special occasion?
No, whoever is having a special occasion this week.
Yes, I just invite you all, right? I just invite you all who are having a special occasion today to let us know about it so we can celebrate with you. Any marriages, birthdays, wedding anniversary, special. I'm not hearing. Could you?
I think,
that's a part of our meeting?
No, I think that's coming from
I'm gonna try and
President Anthony. If you can mute him, because I don't think he knows his microphone.
Okay.
But
Okay.
Go ahead, DP Junior.
Yes. Is there anyone that would like to share a special occasion with us tonight? A birthday, anniversary, wedding anniversary, birthday, special occasion? Tell us about it.
Not sure anybody is born in October.
I was born in October.
Oh,
actually,
so
I should.
celebrating a birthday?
Yes, actually, I should tell you.
Yes, go ahead.
I'm always an hero. You know. My birthday is the 20th of October.
There you go.
Just a day before Heroes Day.
Always a hero. So happy.
Yeah.
You can't wish yourself happy birthday. So on behalf of Kiwanis and Kiwanis Club of Kingston, I extend to you a happy birthday when it comes along, DP Junior.
Okay.
Happy for you. Every day above ground is a day to be cherished.
Tell me about it. Tell me about it. Tell me about it. I'm certainly enjoying it.
All right.
Right? Anybody else on a birthday?
Yes, I've got a birthday. This is DP Audrey from the Kiwanis Club of Sunshine City, Portmore. Tomorrow is my son's birthday, Kiwanian Alwyn, and the next day is my birthday. And on the same day, another Kiwanian from Sunshine City is celebrating a birthday. So, Sunshine City as the October 22.
The October group. Welcome to you all. Happy birthday to you all. Right?
President Stephen.
Thank you.
Yes.
Yes.
Go ahead.
Yes, the 23rd of October will be my birthday. And the following day, the 24th of October, will be 33 years that I have been called to the bar, which is my legal anniversary.
Wow.
And the 26th will be 33 years, my wedding anniversary.
Indeed. Wow.
My wife put up with me for 32 years, but each day she tells me that I'm like KFC. Nobody does it better.
Wow.
And no one loves it. So I celebrate those milestones. The 23rd, the 24th, and the 26th. And this year will be my diamond jubilee.
Yeah. Happy birthday to you. Happy anniversary.
Happy anniversary and all of those things combined.
Yes.
Glad for you, Anthony. Blessings on blessings.
Thank you. Thank you.
And this is the same Anthony who had done that presentation about the new regulations, right?
That is right.
That is correct. That is correct.
Right. Thank you. Thank you. I remember it well.
And just DP Junior, one more birthday in the chat. Odette Prairie celebrates her birthday on the 6th, or celebrated it on the 6th. So belated greetings to her. Yeah.
Happy birthday. Happy belated birthday, Odette. All right. If there's no more celebrations, I'll turn over back the mic to you then.
Hi, PP Junior.
No, there's okay. Sorry, I'm rushing.
Yes, I just two celebratory things. We're 15 days into the new Kiwanis year, so congratulations, Governor Pam. You're 15 days of your calendar, and so for all new clubs leaders. So time is running, so enjoy your year. My second exciting news: my granddaughter Zara. She did very well in her the fourth year, grade 4 PEP. She got 37.4 out of 40. So we're looking for good things. And all for all the persons, grade 4, our children, grandchildren, our cousins, Kiwani's family, congratulations. And the PEP results.
Yes. Thank you, DLG Eileen. And congratulations to all the grade 4 students. Those who did well, those who did not so well, congratulations to you all as well.
Okay, back to
any other?
Back to President Stephen. Back to President
Yes, go. Back to President.
Yes, thank you, everybody. Happy birthday to everyone. Going back on the program, we want to get to the main attraction. We're running a little bit late, so we'll just move it along. Apologies. We do have a lot of apologies, mainly from a lot of our stalwarts. So let me just quickly run through the apologies from Kiwanis Club of Kingston. First of all, as you'll notice, DLG Willie is not here. He extends his apologies, as well as past President Newton, IPLG Desmond, Vice President Zuri, and DP Stan Donwell. So all of those persons who are, usually here for the meeting had other commitments and are extend their humble apologies for their absence this evening. Including in those persons that I mentioned was also our Kiwanis Education, who is IPLG Desmond. So what I will do as a good Kiwanin or a good Scout is improvise. So I'll just give an abridged Kiwanis Education, and then we're going to move right into our introduction of the guest speaker. So Kiwanis Education today is just to bring awareness for those of you Kiwanians who may not be aware or who know the history of it, is that there is a Kiwanis Foundation of Jamaica. It was formed quickly. It was formed in 1991 with these Kiwanians, DLG Mike Enriquez, DLG Robert Blackwood, past Governor Carlton Levy, DLG Fitzroy Ramsey, DLG Oswald Lee, DLG Lloyd Distant, and DLG Las Lewis. And the Kiwanis Foundation of Jamaica's mission is to assist Kiwanis clubs in Jamaica serving the children of the world, often in ways that would otherwise remain beyond the resources of the clubs and the divisions. And it subsequently adopted the motto in the services of humanity. Some of their major achievements include establishment of the Kiwanis Foundation of Jamaica Godfrey Dyer Scholarship in August 2004. They also jointly with the Council of Past Lieutenant Governors in Jamaica organized an all-island convention of Kiwanis clubs on behalf of all 4 lieutenant governors. The foundation has also established a series of awards which are presented, the Frank Melhedo Award, the Charter President Award, and a number of other awards. And they also produced a book. This is in 2009, which is called The History of Kiwanis in Jamaica from 1964 to 2009, outlining the achievements of the movement in Jamaica over the 45 years, those 45 years between 64 and 2009. So I'll leave the rest up to you, but you can research the Kiwanis Foundation of Jamaica and the work that it has done over the years, and it continues to do towards this movement. And that concludes Kiwanis Education, an abridged version in the circumstances. So now, ladies and gentlemen, we're going to move on to our main, what most people are here to see and hear. I'm going to hand over to our club meetings chairperson, past the distinguished President Stuart Spencer, to tell you more about tonight's presentation. Over to you,
Thank
DP.
you. Thank you, President Stephen. Fellow Kiwanians and guests, it's quite interesting to see the turnout. We have a very interesting topic here for you tonight, but I wanted to just give you a little preamble. This presentation by Dr. Baptiste was done actually 1.5 years ago, just about 1.5 years ago. And I watched it again just recently, and it's amazing how much I had forgotten. And, it struck me, this is something that we really, I think could explore, because even if you saw it, you probably will not have remembered some of the vital information that you provided. So I'm going to begin. I had introduced him the last time, so I'm not going to go through that part. I'm gonna let you hear the introduction that I did at that time 1.5 years ago. All right. So I'm gonna share my screen, and we take it from there.
DP Stu, it seems to be queuing up at the end, so you may have to carry it back to the start. That's why you're running into that difficulty.
Yeah, I'd already set it where it should be. So that's what was puzzling me.
I'm
deputizing for.
Let me welcome all our visitors.
No. Oh, God. Oh, God. Yeah.
Yes.
Fellow Kiwanians and guests, it is my pleasure this afternoon to introduce our guest speaker. And let me just, I just want to keep it simple. He is Andy Samuel Jean Baptiste. He's a St. Lucian national who graduated from the Latin American School of Medicine in Cuba. After the completion of his undergraduate studies, he worked with the Ministry of Health and Wellness in St. Lucia, specifically at the Victoria Hospital in Castries. Dr. Baptiste served a 3.5-year tenure at the Victoria Hospital and was attached predominantly to its accident and emergency department. He subsequently served in the Department of Internal Medicine at the University Hospital of the West Indies for 4 years. He has a passion for internal medicine and a special interest in geriatrics, which is a subspecialty of the discipline. He currently practices privately as a general practitioner. And I just want to add another little word. Kiwani Andy is a recent inductee into the Kiwanis Club of Kingston. And I reached out to him about a month ago, asking him that said I wanted to co-opt some select members to help to work on the club meetings committee. So I would appreciate, and he said he agreed, without any hesitation. So I said to him, okay, put some ideas down for me that you think, might work. And so he put together some of the ideas that he had thought of. And tonight we're gonna hear one of his ideas. So I want the audience to be aware of it. When I looked at it, I said, I thought this was something that could be of value. And so it's in that context that I want to also commend him for putting his foot forward and accepting the invitation to be a part of this committee, and also to present himself as well in terms of what he's gonna do tonight. So with that, having said that, Dr. Andy Jean Baptiste, it's over to you. Thanks again.
Thank you very much for the introduction, and thank you for the opportunity to share this evening. Can I be allowed to share?
Sure. You should have. Let me just give it to you. Although I think you had the option to do so.
It's open.
Yeah, it's open.
Okay. Okay, good night, everybody. Tonight's topic is below the belt. And it's a focus on, let me just get to read, hide fruiting countries. It's a focus on men's health. Now, just an icebreaker. A patient was commenting to his friend that he had seen the doctor and said to him that the doctor said that he would have had him back on his feet in 2 weeks. And his friend, curious to know, said, "And did he?" He said, "Yes, I had to sell the car to pay the bill." I pray that no such doctors existed here. All right, the objective of tonight's meeting is to demystify why men don't like going to the doctor, to create a greater awareness of health issues in men, and to encourage healthy habits and lifestyles. Now, there are some social factors that have impacted on the man and his health. We know that the very nature and nurture of men has influenced his attitude towards health. If he's coming from an environment or a household where being proactive regarding health is a thing, then he's more likely to follow suit versus an environment where there is a nonchalant approach to health. We know from biblical days, the man has been called to be the provider. Society has taught that he's called to be the provider. He's supposed to be a pillar of strength. Defender and protector of the home. He is supposed to always be emotionally strong, not supposed to be fatigued or show any sign of weakness or even sickness thereof. And it has been shown constantly through time. And even when we consider soldiers, back in the earlier days, soldiers were actually left behind because they were thought to contribute to slowing down the pack or causing the group, to function less optimal. So the Huffington Post in 2016, they did a survey over a 2-year period just to find out why exactly men don't like going to a doctor. 52% actually said that nothing would keep them from making an appointment to see the doctor. But of the 48%, what you see now is the result from the survey and the reasons why they opted not to go to a doctor. And I should also say that participants were allowed to choose whatever reason they identified with. 22% said that they were too busy to go to the doctor. 21% said that they were afraid of finding out if anything might be wrong. 18% complained of getting uncomfortable body exams, and we know especially for men, it's the dreaded rectal or prostate exam. 8% said that the questions were too personal. 7% were afraid of getting weighed, and another 7% didn't want to get naked at all. 4% complained that the room was too cold, and 9% had a reason that was not previously identified. Now, below the belt, for those of you who watch boxing or have watched professional wrestling, although more so we realize that in WWF and WWE, realize that very often persons tend to go below the belt. And in true sportsmanship of boxing is actually frowned upon, and it's regarded as not being sportsmanlike. It's an issue, and it comes with a penalty for persons who actually strike below the belt. So if in sports there's such great regard for targeting below the belt, we can understand and appreciate how important or how significant matters below the belt supposed to be to us men. And like I usually tell my male patients, for me, even as a doctor, I mean, putting a doctor aside, I'm first and foremostly a male. Anything below the waist for me is an emergency. And tonight we want to create greater awareness of health issues arising below the belt. think I've gotten my slides a bit mixed up. All right, so one of the things that I wanted to focus on is the prostate. Now, the prostate, oftentimes a patient may have an enlarged prostate, most times determined based on physical exam and based on symptoms or signs that that patient might present with. The prostate is a small walnut-shaped gland in males that produces a seminal fluid that nourishes and transports sperm. Prostate cancer is one of the most common types of cancer in men. Some types grow slowly and remain confined to the prostate gland where they may not cause serious harm. Other types are more aggressive and spread quickly. I got my slides mixed up just now. In terms of the location of the prostate gland lies just below the bladder, and it actually surrounds the urethra. The urethra is this hollow tube that leads from the bladder through the prostate and to the glans penis, commonly called the head of the penis. So that small orifice that you would see at the head of the penis is actually the meatus. It's the opening of the urethra. So the following pathologies are actually associated with an enlarged prostate. Now to the left here, we would see a normal prostate. As we said previously, the prostate is this walnut-shaped gland to the base of the bladder, right? And it goes around the urethra. When this prostate enlarges, right, it actually compresses the urethra, this hollow tube where urine can flow freely, no longer flows freely, right? When that happens, it can actually cause decrease in the force of the urinary stream. So men, you would recall that when you were a boy, you were able to urinate and your urine would shoot and shoot very far. But when the prostate is enlarged and obstructs the free flow of the urine, the force of that urine stream is not as strong as before. Patients may feel a constant need to urinate because every time they urinate, the bladder no longer empties completely because it's now obstructed. There might be dribbling after you finish urinating. So you've urinated, and normally men after urinating, we shake the penis to get rid of the urine that might still be in the urethra. But even after shaking, there is a constant trickle of urine. This is called dribbling. For some men with enlarged prostate, they might actually have a difficulty initiating urination because they have to now push harder and bypass this obstruction so that the urine can flow freely. One of the pathologies that come with an enlarged prostate is prostatitis. Now, the section of this word itis, itis means inflammation, and prostatitis is simply the inflammation of the prostate gland. When that occurs, urination becomes very painful. The patient might also have pain in the groin, the pelvic area, and also in the genital. Now, most commonly, the cause of prostatitis is usually bacterial in nature. There's an entity called benign prostatic hyperplasia, and all that simply means is that the prostate gland is enlarged and not cancerous, right? Enlarged and not cancerous. The symptoms are pretty much in keeping with what we previously explained because it's an enlarged prostate and the effects are similar. It will block off the urine, cause incomplete emptying of the bladder. You may have to force more to urinate. You want to urinate very frequently, and you will experience some dribbling. Now, with factors that can affect or influence one having benign prostatic hyperplasia is aging. As you age, in most persons, the prostate tends to become larger. Family history. If there is a history of prostate problems, particularly an enlarged prostate that is not cancerous, right? Then one is likely to have the same because of genetic predisposition. Doesn't mean that they definitely will have, but it just means that they are likely to have an enlarged prostate of a non-cancerous origin because of the family history. Diabetes and heart disease have been shown to also contribute to an enlarged prostate. Lifestyle. And under lifestyle, obesity actually raises the risk of having benign prostatic hyperplasia. And exercise and dieting appropriately can help to reduce that risk. Want to touch on prostate cancer? Or before I go off to prostate cancer, this slide was done already. Want to go across to prostate cancer. Now, prostate cancer in of itself, it's simply an abnormal growth, a tumor within the prostate gland. Depending on the extent of the tumor in this gland, you can have symptoms of obstruction as we previously described. Among the factors that affect or factors that predispose one to have prostate cancer, age. Prostate cancer is more common in the older age groups, and it does not mean that because you're elderly or up in age that you automatically have prostate cancer. That's not the case. Race. Now, for some reason, it has not yet been determined, but for some reason, Blacks are more predisposed to have prostate cancer. And they're not only more predisposed to have prostate cancer, but prostate cancer among Blacks tend to be more aggressive. And usually at the time of diagnosis, it may be very advanced. Family history, again, we're talking about genetic predisposition. If there is a first-line relative, father, sibling with prostate cancer, it puts you at high risk of having prostate cancer. Studies have also shown that for men who have first-line or first-degree relatives who have breast cancer, or actually have the BRCA1 or BRCA2 genes that code for breast cancer, there is a strong risk of having prostate cancer. And of course, obesity in of itself puts you at higher risk of having prostate cancer in comparison to persons who are slimmer. All right? And I really want to drive that home regarding obesity. We know that lifestyle modifications can contribute to obesity, whereas it's also true that genetic makeup and hormonal issues can contribute to obesity. And I'm stopping here to emphasize on obesity because where it is possible to modify one's lifestyle and contribute to a decrease or a resolution of one's obesity, it should be considered, and we should not take it lightly. Sadly, in our society, I think that not much emphasis is given to obesity. We don't see it as an illness, and it's actually an illness. So common symptoms associated with prostate cancer: having trouble urinating, as we said before, decreased force in the urine stream. One may have blood in the urine or blood in the semen. A bone pain, especially when the cancer is no longer confined to the prostate but has extended to the surrounding bones. Losing weight, losing appetite, erectile dysfunction. Prostate screens. I want you to focus particularly on this image to the left here. Soldier goes to the doctor with gun in hand, says, "I think we can skip the prostate exam this year, doc." And this is the approach, or this is the sentiments that a lot of men share towards having a prostate exam. Now, while it is true that both a digital rectal exam and a prostate-specific antigen, commonly called PSA, which is a blood test, can give information regarding the prostate, there is benefit in both of them, and neither is more superior than the other. Why do doctors like doing a prostate exam? As we see here in this image to the center, we see the prostate gland here. This is the bladder here, the prostate gland, and the rectum. The prostate gland is actually in close proximity to the rectum. By simply putting in a finger, the doctor is able to appreciate the size of your prostate, to determine the texture of the prostate. Is it hard? Does it feel like there are nodes in the prostate, right? When the doctor does the exam, does it provoke any pain in the patient? And all of that is important because you could actually have a patient with a normal blood test, a normal PSA, which does not tell you if a prostate is enlarged or not. Another reason why your doctor would need to do a prostate exam for you. Doing the prostate exam allows him the changes in texture, whether it's nodular, hard, or soft, allows him to determine, okay, if I have an enlarged prostate, is this cancer or not? Often in prostate cancer, the prostate gland is indurated and tends to be nodular. Is this prostate enlarged, and is it also tender, which is common in the case of prostatitis? And I'll have you know that there are times where men may be asymptomatic of their prostatitis, or it's only on examination of the prostate that they actually realize that they have pain going on down here. Oftentimes, men tend to dread the prostate exam because the doctor might not be as gentle as he should be, especially in the case of a doctor who has large hands. It could be very uncomfortable for a patient. But suffice it to say, we know that naturally things only come out of the rectum. While it is true that the prostate exam actually causes some discomfort, and for some it may cause pain, it is what we like to refer as a necessary evil, because lots of information can actually be derived from the prostate exam. Regarding the prostate-specific antigen, this is a protein which is produced by the prostate gland under normal conditions. It's also produced by malignant cells. It's usually elevated in the presence of prostatitis. And if you recall, we said that prostatitis is the inflammation of the prostate gland. And it's also elevated in BPH, which is benign prostatic hyperplasia, non-cancerous enlargement of the prostate. It's, however, markedly elevated in the presence of prostate cancer. Now you can understand and appreciate that a doctor having an elevated prostate exam, he cannot differentiate through the myriad of pathology that can be happening at the level of the prostate. And hence why we emphasize that a prostate exam, although uncomfortable or maybe painful to the patient, is a necessary evil because it offers lots of information to your physician, and information that helps your physician to give you the optimal care and to contribute to your improvement health-wise. Now, who should be screened for, or who should have a prostate test? I remember that my doctor back home is actually a urologist. He just happens to be a urologist. And I remember presenting to him, I was 19, 20 at the time. And there was no reason, absolutely no reason why at 19, 20, I would have warranted a prostate exam. And I had a prostate exam. Now that I'm a physician, I consider it an evil in of itself because there was no indication. But understanding that this man is a urologist, I guess it was befitting of him, being that that was his line of specialty. So men who are age 50, for men who are at age 50 and greater at average risk of having prostate cancer and expected to live at least 10 more years. Men who are age 45 and are at risk of developing prostate cancer. This includes African Americans. As we saw before, we saw that African Americans are predisposed to have prostate cancer. So having that as a risk factor, once you're greater than age 45, you definitely should have a prostate exam. If you have a first-degree relative diagnosed with prostate cancer, at that age, you certainly should have a prostate exam, even if you're not of Black ethnicity. And certainly, if you're younger than 45 and you have a first-degree relative who has prostate cancer, you should also be tested. I want to move on to the testicles. Now, the testicles are simply egg-shaped glands inside the scrotum that produce sperm and male hormones. The testicles are also called the testes. Now, we've often heard of the breast self-exam. Men, if you didn't know, now you know. There is a testicular self-examination. And doing a testicular self-exam offers a lot of information, and it could actually alarm you to changes in your body. Now, in order for us to know what is abnormal, we must first know what is normal. The ideal time to do a testicular self-examination is when you're in the shower, right? You're in the shower, you're by yourself, you don't have anyone to disturb you, or neither do you have anyone to walk in on you and make you feel uncomfortable in the case where you live with other persons that you might not necessarily be very comfortable with. And besides, if in the shower you're already naked at that time, so it puts you at the ideal time for you to go ahead and have that examination. And we know that when you have showered, especially with warm showers, the scrotum tends to be more laxed or stretched, as you may commonly refer to it. And with that, you're able to better examine the testicle. It's usually advised that you stand in front of a mirror to assist in the examination. Particularly in persons who are centrally obese, i.e. persons who have very huge So what you do, most males would be familiar with playing video games, be it a PSP or having a console. The concept is pretty much similar. You're gonna take your thumbs and put them to the front of the testicle, and you're going one at a time, of course. And your index finger, just as your index finger would be to the back of the console, you're gonna slowly go down the testicle, right? And when you do so, you're actually feeling for lumps, changes in the size of the testicle, or any irregularities. Now, I mentioned irregularities, and I want to emphasize again that to first be able to determine what is irregular, one must know what is regular or normal. Now, there is a tube-like structure that actually connects to the testes. You feel it attach the testes, that's the epididymis, and there is a cord that leads from that going up, that's your spermatic cord, lest you should not know what is regular. And of course, we're in the era of information where information is readily available. So I want to challenge every man who is here to familiarize yourself with documents. There are videos on YouTube. And of course, ladies, you're not exempt. I want you to encourage the males in your life, be it relatives, friends, co-workers, to familiarize themselves with the normal anatomy of the testes, and so that they can be able to do testicular self-exams. So again, when you do those exams, we're looking for any pain, any lumps, any swelling, changes in the size of the testicle, changes in the texture of the testicle. Of course, by texture, if the testicle feels hardened, if it is softer than usual, if there is any fluid in the scrotum. And speaking of fluid, sometimes there is a membrane that covers the testicle that actually becomes filled with fluid. I have seen patients who are actually pleased when that initially happens because they feel, hey, my testicle is getting larger. But it's not something that should be rejoiced in, especially if you're an older male, you've already stopped growing. If you feel that there is a pocket of fluid surrounding the testicle, you certainly should, forgive me, you certainly should be seen by a doctor. It just has to be excused whilst I log out of WhatsApp. Unwearable, lest I should be disturbed again. Give me apologies. All right. There's an entity called orchitis. Now, all this, as we said previously, itis is inflammation. And orchitis is simply the inflammation or one or both of the testicles. Now, it can be because of bacterial or a viral infection, but most times it's usually a resultant of a bacterial entity. And of course, orchitis is seen more commonly in patients who have sexually transmitted diseases. So persons who have chlamydia, commonly persons who have chlamydia, gonorrhea, you would see them presenting with orchitis. In some cases, it may be caused by mumps. Now, as it pertains here, you see this red testicle, which is a bit more enlarged in comparison to the normal testes to the left. In terms of symptoms of orchitis, symptoms can develop suddenly. You have swelling in one or both of the testes, pain ranging from mild to severe. Patient might present with fever, might have nausea or vomiting. There might be this general feeling of being unwell. And of course, because we said that most commonly it's associated with sexually transmitted infections, there can be a penile discharge associated with orchitis. As I said previously, attached to the testicle, attached to the testes, there is this structure called the epididymis. Now, what is the epididymis? The epididymis is a narrow, tightly coiled tube that is attached to the testes, to the testicle. Now, sperm cells move from the testicles to the epididymis where they mature and are stored. In the case of epididymitis, or epididymitis as it is also referred to as, the cause of infection, the cause of inflammation is usually a bacterial infection, right? And as we said previously, just as in the case of orchitis, gonorrhea and chlamydia are often causes of epididymitis. Most cases, well, let me not say most cases, often a patient might present with both inflammation of the epididymis and of the testes, a condition that is called epididymal orchitis, since it involves both the epididymis and the testes. Symptoms: the scrotum, the epididymis is enlarged. Well, it's more of a sign, epididymis is enlarged. It is tendon palpation. It may be swollen. The scrotum may be discolored also, in addition to be swollen. Patient has excruciating tenderness. Usually on one side, if it is one testicle that's affected, and in the case where it is both, it will be bilateral. May have frequent need to urinate, may have pain on passing urine, and that could also be because of an associated urinary tract infection. There may be a discharge from the penis if it's due to sexually transmitted disease, and patient can have, depending on the degree of the severity rather of the epididymitis, the patient can have discomfort in the lower abdomen, can have fever because this is inflammation, especially on a background of infection, and can note blood in the semen. Testicular cancer. Now, testicular cancer is a rare type of cancer. In the US, they've noted that it is most common between the ages of 15 and 35. Now, lest the younger men should feel comfort in the age, you're actually at greater risk of having testicular cancer. And as I said, this is information or data coming out from the US. Sadly, I don't have statistics of testicular cancer for the local population. Now, the good thing about testicular cancer in comparison to prostate cancer, testicular cancer is highly treatable even when it is advanced, meaning it has spread beyond the testes. And it doesn't matter what stage one may present at that time, treatment, the prognosis is usually good with treatment. And again, as we see to the left, it's a tumor that is attached or growing out of the testes. Just to emphasize once more, if one is in the habit of actually doing a testicular self-examination, you would be able to pick up this irregular node or this bump on the testes, or pain on the testes, and that would be a red flag that should, and I say that should lead you to a doctor's office, because most men tend to have a very delayed response to help. While still in the testes, there is an entity called varicocele. Now, when you hear or think of varicocele, it makes you think of varicose veins, which are basically enlarged veins. Now, just as in the case of varicose veins, where there is a disorder with the valves in the veins. Now, valves help for blood to flow in one direction. So the blood flows from the body to the heart in the vein. When the valves are faulty, as in the lower right corner, when the valves are faulty, they don't close and prevent the backflow of blood. So what actually happens is that there is a pooling of blood, there is a backflow of blood, right? And that blood pools in the vein and causes a distortion or this irregular and enlarged shape of the veins that lead from the testes to the rest of the body, or going back to the heart, carrying blood back to the heart. When those blood vessels are enlarged, men, what you're actually looking out for is noodles or spaghetti-like structures within the scrotum. So if you're doing your testicular exam and you feel like there are these noodles, ramen-like, just to paint an image or give you an idea of what you should feel, what it should feel like. If you're to feel something like that, you need to see a doctor. In terms of symptoms, a dull aching pain or discomfort is commonly felt, right? And that is usually felt predominantly with standing. Lying often relieves the pain that is felt. You could feel a mass in the scrotum, and as I mentioned previously, that mass may feel like noodles. Some persons describe it like a bag of worms. The testes might actually be different sizes. If it's one that's affected, one might be larger than the other. If it's both, you could actually feel that they're bigger or noticeably smaller, sorry, not bigger than the other. Varicocele can contribute to infertility in men, but it does not mean that every man who has varicocele will be infertile. And in terms of treatment, it's actually surgical intervention. I want to touch on erectile dysfunction. Now, erectile dysfunction is simply the inability to get and to keep an erection which is firm enough for sexual intercourse. Now, having erection trouble from time to time is not necessarily concern. You might find that usually when you wake up in the morning, you might have this glorious rise. One day, for some reason, you might not notice that you have this strong, glorious rise. Some men will report that having a morning erection, and especially if they want to urinate, some men usually say that they have to sit at the bathroom to urinate. I've had patients before who say, "Doc, I have to urinate in the shower and run the water thereafter." But not having that glorious rise on one occasion or one or two occasions is not a cause for concern. If it's a persistent occurrence, then definitely it's cause for concern. And of course, erectile dysfunction can cause stress, affects your self-confidence as a man, knowing that there are responsibilities, especially for, well, let me not say especially for married men, because both married and unmarried men engage in sexual practices. So there is expectation from one's partner that he should be able to perform, and not being able to have an erection that is strong enough or that lasts long enough for sexual activities actually affects the man's psyche, affects his self-confidence, and once that starts to happen, it will reflect in his ability to function from day to day, not just in the bedroom, but can affect his ability to function at work as well. As we said previously, in terms of symptoms, trouble getting an erection, keeping an erection, and there can also be reduced sexual desire. And again, the reduced sexual desire is largely in part because of decreased self-confidence, knowing that these issues are ongoing. Now, in terms of the causes of erectile dysfunction, it can be vascular in nature. There is a great blood flow to the penis that actually contributes to the ability to have an erection. All the entities or the illnesses that affect the blood vessels. So we think we're referring to high cholesterol that might cause atherosclerosis and block off blood vessels, just as atherosclerosis is a problem in the supply of blood to the heart. It would also block off the supply of blood to the penis and affect the ability. Once blood flow is being restricted, we know that blood is not rushing into the blood vessels of the penis as quickly as it should. The blood vessels are not becoming as packed, for lack of a better expression. That column, which is the blood vessel, is not being filled up with blood as it should in normal blood vessel, and prevents an erection from happening. Diabetes is also a contributing factor, as diabetes actually affects the nerves, and there is nerve supply to the penis. So if you have uncontrolled diabetes, that can actually be a contributing factor to erectile dysfunction. Lots of medications, especially blood pressure medication, contributes to erectile dysfunction. Now, some blood pressure medication work by relaxing the blood vessels, and when they relax the blood vessels, constriction of the blood vessel doesn't happen as in comparison to before medication would have been taken. When that happens, the pressure of the blood, just as the blood pressure medication brings down your blood pressure on a whole, the force of that blood, the pressure of that blood that goes to the penis is also reduced. So often patients would say that they stop taking their blood pressure medications, particularly their blood pressure medications, because it causes them to not be able to have an erection. Now, to be quite honest, as a male myself, if something were to cause me to not have, if medication were to cause me to not have an erection, while it is true that I recognize that the medication is causing that, and I wouldn't not want to take something that causes some kind of adverse effect. The ideal thing to do is to not stop your medication altogether, but sit with your doctor, make your doctor, him or her, aware of what the medication is doing to you, and the two of you can come to a consensus as to what medication would be ideal for you, which will treat your underlying condition. And I'm now referring not only to hypertension, but any other medication that's affecting the ability to have an erection. Having now brought that to the attention of the doctor, they're able to change around your medication and give you something that may have less of an effect. Now, there are neurological factors, of course, in patients who, by neurological, we're referring to the nerves. In patients who have trauma, spinal trauma, may not be able to have an erection. While we spoke of diabetes, we did mention nerves being affected. That will also fall into neurological. A component that was not mentioned is psychological. And when we talk about mental wellness, or mental health being underemphasized, you really see where it affects men as it pertains to erectile dysfunction. If a man is overly stressed by day-to-day responsibilities, it's possible that he will not be able to have an erection. Stress not only, I've had cases where there are marital issues, major arguments, and just because of that, even if there is desire by the wife, the man, because he's so angered by whatever issue that may have occurred before and is still unresolved, not be able to have an erection. Depression can lead to inability to have an erection. And this is why mental wellness, this continues to be a tongue twister. This is why mental wellness or mental health must not be taken lightly. There are endocrine problems, especially when testosterone may have decreased significantly, may contribute to erectile dysfunction. In terms of recommendation, now some of what we've discussed before, there are things that we could actually do to prevent or to diagnose early these entities. I want to emphasize that prevention is always better than cure. Prevention is always better than cure. And we spoke of obesity being a risk factor for having BPH and having prostate cancer. And simply because obesity, it contributes to an increase in insulin growth-like factor, which actually molecular substance that can actually contribute to abnormal growth of tissue. Exercising in conjunction with diet actually contributes to decreased weight, which decreases the likelihood of you being obese and favors not just that, but as it pertains to hypertension and diabetes that can affect or be a risk factor for benign prostatic hyperplasia, BPH, and also contribute to erectile dysfunction, and also exercise and dieting contributing to lowering of your overall cholesterol levels, so you don't have atherosclerosis and don't have blockage of your blood vessels, not only at the level of the heart, but also at the level of the blood supply to the penis. Compliance with medication, if one is on medication, and restrictions. If you're on hypertensive medications, don't say that you're tired of taking your hypertensive meds, because if you have uncontrolled hypertension, as we saw previously, having uncontrolled hypertension, having uncontrolled diabetes are risk factors to BPH and to erectile dysfunction. If you're supposed to be restricted in terms of your salt intake, restricted in terms of your diet, please follow suit. Keep scheduled follow-ups. In as much as men, we can understand and appreciate if men don't like going to doctors, they're certainly not going back once they feel well. And that is a big no-no. Seek support. Now, sadly, earlier on, I spoke about social impacts and I spoke about nurture and nature. A lot of those illnesses are usually things that men will not feel comfortable disclosing to each other. But there is no shame in having or identifying somebody who can support you as you go through whatever process, be it affecting your prostate, affecting your testes, whatever it is. Find at least one person to confide in, one person who can encourage you as you go on this journey, knowing that health tends to affect psyche and that can lead to depression. So you definitely want to seek support. And there are lots of groups. You'll be surprised how many support groups there are online. There's a support group for everything. And just as in Alcoholics Anonymous, you could actually get information from persons who are struggling with the same condition as you. And that is encouraging in of itself to be able to weather that storm.
Andy?
Mango season, and I put up this picture for a purpose. I wanted to see and note that even on this tree, it's probably not the nicest mangoes, and one might say it pretty much looks like a common mango, but this is not the focus of this image right here. There are green mangoes on the tree and likewise this ripe mango. But take your eyes to the bottom of this mango tree. There are some mangoes we see are notably green while others are ripe or even brown, rotting. In St. Lucia, it often says that green mangoes leave ripe mangoes behind, which means, sorry, let me take that back. Ripe mangoes leave green mangoes behind. And what the gist of this saying is that sometimes younger persons die and elderly persons who are thought to be more likely to die off because of their elderly age or their fragile condition being less vibrant. And this is a warning to the younger men that you're not exempt regarding issues pertaining to the prostate and the testes. And just to drum into your hearing once more that even with testicular cancer in the American population, it was the younger age group that was affected, 15 to 35. A stitch in time saves 9. And in this picture, we see this woman literally sewing a patch onto this man's pants. The size of the hole, we don't know, but she's sewing nonetheless. And ladies, I'm happy that you're connected tonight. Just as this woman is stitching the pants of this gentleman, I want you to be the reminder, that gentle push or gentle kick, even if it's necessary and comes to that, to the men to be more proactive and more serious as it pertains to their health. And men, for us, early intervention, early detection, prevention can help us avoid major complications or help us to have early resolution of whatever conditions that we may have below the belt. So this has been a brief summary of some conditions below the belt, and I trust that it has been easy for you to understand and everybody leaves here edified at this time.
Thank you, Andy. That really was comprehensive, and ladies and gentlemen, I have to pause it there. It is the end. Unfortunately, Dr. Baptiste has to be on duty tonight, and he wasn't able to be here physically. Otherwise, he could still take questions. But as you all know, I'm sure the time is running, and I hope that you were able to, pick up something that will be of use to you. And if any of you have any questions that you'd like Okay, send me a WhatsApp, mine, and I convey and I certainly will get it back to you. My number is 812-1965. So if anybody really has something that they really want me to get an answer for, send me a WhatsApp message and I will speak to Andy and we'll get a response to you. But that's how we have to treat it for tonight. Thank you for listening. Thank you. Back to you, President Stephen.
Thank you, DP Stu. We're running a bit late.
President, could you ask DP Stu to repeat his number?
Sure. DP Stu, can you repeat your number, please?
Yeah, it's 812-1965. Got that? 812-1965.
Okay, thank you.
You're welcome. Okay, President Stephen, bye-bye.
Yes, sure. We're running a bit late, ladies and gentlemen, but I'm sure you understand, as DP Stu mentioned, the presentation was quite comprehensive and a lot of information was shared. I hope you found it informative and helpful for your own purposes. I'm going to ask now if PDT Ralston can be our Sergeant at Arms, because our regular Sarge, which is VP Zuri, is not available this evening. If you can do a quick one for us, Ralston.
Sure, President. First you need an extension.
Yes. I'm asking the members of the Kiwanis Club of Kingston for an extension of 10 minutes till 9 o'clock so that we can conclude all our activities. Can I have somebody move the motion, please?
I move.
And somebody seconds? I will second you, PDT. Ralston, please proceed. So
okay.
We're now at Sergeant at Arms.
Let me be as quick as possible. I really wanted, I'm surprised that Andy is not in person because I wanted was to Sarge him because in his introduction, I heard that he specialized in geriatrics, and then I wanted to know why he joined the Kiwanis Club of he trying to secure some business or something like that, but I will get him at another moment. This young boy attended a funeral, a wedding, same thing. And after the service, his cousin asked him, how many women can a man marry? And his quick response was 16. 4 better, 4 worse, 4 poorer, and 4 richer. But IPP Junior for consistently interrupting the speakers. Yes. And I think we have to Sarge him. So while I'm giving a blanket Sarge, these persons have to pay a little extra. The blanket Sarge is $200, but Junior will pay $5, and they will pay $5 when we get him. But you, President, you're through your secretary.
Yes.
So as Kiwanians, we like to be referred to as Kiwanians, not ladies and gentlemen. I think that's a habit you have to break you out of. So your secretary will pay.
Yes, he will. And duly noted.
I see a member of this club was driving along the Mandela and his phone rang. Answering, he heard his wife's voice saying, Stuart, I just heard on the news that, a car is going the wrong way on the Mandela. Be careful. Stuart's reply was, hell, it's not just one car, hundreds of them going the wrong way. So, President, the last charge is for Earl Spencer. Finally, after many years, at the last meeting, we were able to mute him, so he didn't get in a word. And it's not often you get to mute a party's member of the club. So Stuart will pay. Earl, sorry. Stuart, Earl will pay $500. And last and not least, President, is that this elderly man was invited to some house for dinner. So while the persons were in the kitchen preparing, he asked the youngster, what are they preparing for dinner? And the youngster said, goat. Him said, goat, you sure? How you know? Him said, well, you heard his parents speaking and one said, might as well we invite that old goat over for dinner. President, I don't know if I did well, and Zoe will find, because that's the extent of my side.
Very well done, PDT Ralston. Humorous and relevant, indeed. So thank you very much for that.
Make sure that the fines are
yes, are collected. Yes, I will ensure that is done, definitely. So Kiwanians, before we conclude, obviously we have notices and announcements, and there's a lot going on in Kiwanis. As I mentioned earlier, DLG Willie is not here, so I'm going to deputize for him and just share with you some of the activities from the Kingston side, and then I'm going to ask some of the other clubs who are here if they have any announcements they can make that at that time. So first of all, I need to tell you that this week is CKI week from October 14th to 18th, and as part of that celebration, there's going to be a joint meeting with young YPSA, Kingston, 23 CSO, Nation Builders, and of course, Kingston Club, where we're going to learn about youth protection guidelines with DLG Beverly Thompson. And that's going to be this Thursday, the 17th at 7 p.m. on Zoom. If you're interested in attending, the flyer is out and you can get the Zoom particulars. So that's October 17th at 7 p.m. DLG Beverly Thompson talking about youth protection guidelines. Also, just to remind you that Kiwanis 1 day is going to be October 26th, and you'll be hearing more information about that. I know the clubs across the division are making various plans, and just put that down in your calendar. Kiwanis 1 is going to be a special day celebration across the whole division. And then also, this Saturday is the third Saturday. So Kiwanis Club of Kingston, along with Barbican, are going to have their feeding program at the Marie Atkins Shelter on Hanover Street. That's on Saturday. Kiwanis Club of Kingston members, please remember and participate. If you would like to join us, you can reach out to myself or DLG Willie about that. And I'll just tack on that. Remember, I mentioned at the beginning that we're continuing our Hope for the Homeless program. We're making donations to the homeless community, and we're asking if you have any donation of men's clothing, particularly size medium or small, canned goods, shorts, caps, anything of that nature, casual clothes for the homeless. Please get in touch with us, and we'll make sure that it is part of our donation at the feeding program this Saturday. That's why the deadline is actually this Friday. So if you can get it to us by Friday, then we can incorporate it into our feeding program on Saturday. That's it from Kiwanis Club of Kingston, but I see a lot of clubs are here. So I'm going to open the floor to any other Kiwanian club that wants to make a notice or announcement at this time. The floor is yours. Please open your mic if you have any announcements to make.
President, I have one announcement. I'm making an appeal to honest ladies. Somebody left a comb in my car, and I'm trying to find out who's the person. A lady's comb.
Hello.
You may have to explain that.
I want to find out who leave it.
The ladies will know who they are who are traveling in your car. So hopefully that it's not a wide group, and we'll find the owner very soon.
President Stephen, just one little word.
Yes.
I didn't take any chances tonight. I'm on the computer.
And I'm hearing you loud and clear. Yes.
I couldn't manipulate my phone.
Yes.
And then I really got muted. So I will happily pay that fine. And I didn't realize Raleigh was looking out for me.
There you go. 40 people. So yes, good to have you back, DP Earl, and I'm hearing you loud and clear now. So there's no other club that has any announcements to make at this time?
President Stephen, this is Sharon Gilzine from the Kiwanis Club of Constant
Hello,
Spring.
President Sharon Gilzine. You're a lady of
I'm
many names.
inviting you all to our meeting on the 22nd of October when we have Mrs. Katie McCoy. She's Miss Cosmo's queen, breast cancer survivor, and she's also an author. She will be there, and she's part of the Reach to Recovery, and she'll be our special guest speaker on that night. And also on the 26th, which is our one-day project, would be a walk in the park, a pink walk in the park, and we're inviting all of you to come on out at 6 a.m. so we can all walk together.
Okay, thank you. And that's a very valid point, Gilzine, that October is actually Breast Cancer Awareness Month. So there's a number of activities both within Kiwanis and outside of Kiwanis. So please do your best to support it in some shape or form. It's a very important part. We're talking about prostate cancer, but breast cancer is also something that affects a lot of our fellow Kiwanians and our fellow Jamaicans. So it's something that we have to work towards trying to eliminate in one shape or form.
And
So
that's a good segue.
Yes, go ahead.
Hi, President Stephen.
Hold on, Director Crystal, 1 second.
No, it's the same thing. Sorry,
Oh,
it's
yes,
the same
Montego Bay. Yes, you're right. Go ahead, Director Crystal. Go ahead.
Thank you, President. The Kiwanis Club of Montego Bay will be having the 10th Diabetes Awareness Health Fair this November the 2nd from 9 a.m. to 3 p.m. in Sam Sharp Square. We'll be doing various tests, so come on out if you're in the Montego Bay area, or please feel free to circulate our flyer to your loved ones so they can come on out and get their checks done. Also, this Thursday, we'll be having our meeting, and the topic is support systems and resources for patients and survivors. And our guest speaker is Miss Patrice Dyer. It's an interesting topic. It starts 6 p.m. sharp. We'll continue to forward the link, and thank you so much.
You're most welcome. Most welcome. And everybody, I hope everybody heard. And those who are going to be in Montego Bay or in Western Jamaica, come out and support for sure. The floor is still open. Anybody else?
President Stephen.
Hi, PP Roy.
Hi, PP Roy from Kiwanis Club of Toronto Caribbean. On Friday, we'll be having our first meeting since we have monthly meeting, and we're going to be having induction of new officers.
Indeed.
Everybody or all clubs on the platform here are invited. Thank you.
Installation, Roy.
Installation.
How can we find the link for it apart from flying to Toronto?
Yeah, we'll be sending the link shortly.
Okay.
Thank you for the correction.
President Stephen,
President.
you mentioned the well, I think Beverly's gonna talk.
Yeah, well, I was about to lead into yes, I mentioned, but I think DLG Beverly is on the call. Go ahead.
Yes.
Beverly, can you tell us more about the presentation on Thursday?
On Thursday, well, that presentation is on youth protection. You are going to be joining online also?
Yes.
Yes, and so come on and listen to the youth protection guidelines and policies. It will be very interesting. That's one.
Yes.
And number two, we're inviting you to our meeting and all who are online to our meeting tomorrow at 6 o'clock at the Police Officers Club. And we are continuing in the Cancer Month information on cancer awareness. And we have two keynote speakers, Dr. Kadeen Origio. She's a pediatric hematologist oncologist. So you will hear about cancer in children, which really is going to be interesting. And Miss Jody Neville from the Jamaica Reach to Recovery. We'll also have items on sale for the awareness of Cancer Month. So that's tomorrow at the police officers. I sent out notices to most of the divisions, And it's going to be online. The link, it's also in the body of the flyer that we sent.
Okay.
So just reminding you to come on out and of course on Thursday, you need to all join in on the presentation.
We will indeed.
Hmm?
Okay, thank you, DLG Beverly. Any other clubs with announcements? Going once? Going twice? Okay, concluding. DP Marcel, are you online with a thought of the week? If he's not, we're running late.
I didn't see him.
Okay, he's not
Oh,
here.
I'm sorry, Prince. I would just like to publicly
Okay, go
thank
ahead.
your songbird, DP Marcel, for his part in the service on Sunday at UCC, the district blessing service. It was beautiful, and he did well. He represented the club well.
Yes, he
and
did.
so we want to publicly say thanks.
Yes,
Again.
thank you. He's a very talented Kiwanian.
Yes,
He
he
plays
is
instruments as
indeed. Yes,
yes, indeed. All right, thank you for that, Beverly. Okay, ladies and Kiwanians, it takes me a while to get out of Kiwanians. This brings us to the end of the meeting. We ran a little bit late. That's not our intention. We're going to try and have tighter management moving forward, but we appreciate you staying on with us, and I hope that you learned something. So at this juncture, I would like to raise our glasses, if you have a glass nearby, and wish a toast to Kiwanis International. Here's my glass. A toast to Kiwanis International and to Jamaica land we love.
And we love.
And we love. Cheers. This concludes the Kiwanis Club of Kingston's meeting for October 15th. Take care, and those who are in transit, get home safely. And those who are at home, wish you a pleasant